Hi, so I am Dr. Meredith Shockley-Smith. We are glad you are here, tuned in. And it is Black Maternal Health Week, as most of you know, and that is likely why you are here. It's an exciting time to gather together to center Black women's voices around reproductive and birth justice. As we know, the disparity is atrocious around infant mortality and maternal mortality, particularly in Hamilton County and in Ohio. And as that becomes more and more apparent and the pandemic hit our state, we are looking at disparities in the same way in that virus. And so we want to take this opportunity to think about and talk about the centering of Black women in all of these conversations. So I'm glad you joined us. And I am going to introduce one of our very special guests, someone who is on the team at Cradle Cincinnati. So the work that we are doing, that I am leading, is Queen's Village, which is a gathering of Black women who get together to listen, to see, and to celebrate Black women as we work for reproductive and birth justice in Cincinnati. As part of that work, we have Lauren Everett, who is the program manager of the Learning Collaborative, and I'll let her share a little bit more about her work and what she does, and I'm excited to have her host this live. Thanks so much. Hi, Lauren.
Hi, Meredith. Thank you. Hello, everyone. Thank you to Queen's Village for having me today. As Meredith shared, I am the program manager for the Cradle Cincinnati Learning Collaborative, which is an initiative out of Cradle Cincinnati that really works to unite community healthcare and prenatal care providers around this topic of transforming prenatal care and bringing all of these professionals together to think about how we can improve the care that women receive. So we have an amazing panel of experts that I'm looking forward to talking with today. This topic of Black maternal health is so critical, as Meredith mentioned, because of the alarming disparities in health outcomes for Black women. In the US, Black women are 2 to 3 times more likely to die from pregnancy-related causes than white women. And it's the same for the state of Ohio. But we believe that through working together, change is possible. So today, we're focused on highlighting the experiences of Black mothers and discussing potential solutions that can shift the outcomes in our community. So as I mentioned, we have a dynamic group of panelists today. So let me take a moment to introduce each of them. So first we have Representative Erica Crawley. Representative Crawley is a mother, veteran, and an advocate. She is a freshman legislator in the 133rd General Assembly, representing Ohio's 26th House District, which is located in Columbus. Her passion and determination has led her to fight social justice issues around early childhood education, maternal and infant health, and addressing housing and homelessness. Representative Crawley is one of the founding members of the Ohio Black Maternal Health Caucus, and she also sits on the Ohio Commission on Infant Mortality and the Commission on Minority Health. Bree Hope is a full spectrum doula, founder of Birthing with Bree, and administrative director to Black Birth Circle. She has worked in the healthcare setting for 11 years as a nursing assistant and patient care assistant. Born and raised in Cincy, she started her birth work journey in 2009 as an extension of her dedication to Black families. As a queer woman, her birth work centers people of all genders and relationship dynamics, including those who are trans, gender fluid, and non-monogamous. She enjoys helping, serving, and keeping birth spaces sacred. She advocates for Black mamas as a doula and birth companion by supporting, listening, educating, assisting with discomfort, protecting space, encouraging clients and their loved ones, and staying by their side. Her fundamental goal is to reduce maternal mental health concerns and improve the infant maternal health mortality rate for Black, Indigenous, and people of color. We have Christine Moore, who is a women's health nurse practitioner with the University of Cincinnati. She has been a nurse practitioner for 8 years, and throughout her career, she has always been a provider for the underserved and uninsured. Christine is very passionate about this population. She takes care of women's gynecologic needs, prenatal and postpartum care. She's a mother to 3 beautiful children, and in her free time, she enjoys family time and traveling, although all of that is on hold right now. And then finally, we have Dani McClain. Dani reports on race and reproductive health. She is a contributing writer at The Nation and a fellow with Type Media Center. McClain's writing has appeared in outlets including Time, The Atlantic, Slate, Color Lines, Ebony.com, and The Rumpus. In 2018, she received the James Arison Award for Social Justice Journalism. Her work has been recognized by the National Lesbian and Gay Journalists Association, the National Association of Black Journalists, and Planned Parenthood Federation of America. McClain was a staff reporter at the Milwaukee Journal Sentinel and has worked as a strategist with organizations including Color of Change and Drug Policy Alliance. McClain's book, We Live for the We, The Political Power of Black Motherhood, was published April 2019 by Bold Type Books. So thank you again to all of our panelists for joining us today. Before we dive into the questions, I want to note that we will have a Q&A with the audience, our viewers, at the end. So please feel free to post thoughts and questions in the comments, and we'll be sure to share that with our panelists towards the end. So our first question is for our entire panel. Can each of our panelists please share about your personal and professional connection and experience to Black maternal health? Bree, if you would like to kick us off.
Okay, I'll go first. Hi, I'm Bree the Doula. And as a queer woman of color, it's both professional and personal for me to center everyone who is Black and having babies. On a personal level, one of my communities is, of course, the LGBTQ plus community, which is so often separated and left out of the conversations about reproductive justice. It's important for me to be a part of merging the conversation to include all bodies that are birthing babies, because when it comes to medical racism, none of us are excluded.
Boom.
I can take it next.
Sure.
So Black maternal health is very near and dear to my heart because as a Black mother and a woman, I know that a lot of times we must advocate for ourselves to ensure that we're receiving optimal care. As a provider, I am aware that not all women know how or when to advocate for themselves. Even as a nurse practitioner during my last pregnancy, I experienced a very dangerous condition where I had to advocate for myself. Statistically, I know that Black mothers die at a rate much higher than white women from pregnancy-related death, as Lauren mentioned earlier. In order for this to change, there will need to be education on multiple levels, from educating and empowering mothers to educating community health workers, nurses, and providers.
Thank you, Christine.
Yes.
Erica?
Black maternal health is very personal to me from my own experience. I have talked about it since I came into the legislature last year. I am the mom of twin girls who are 15. And when I was pregnant with them, I went into preterm labor at 18 weeks and spent the majority of the rest of my pregnancy, which was about 16 weeks in the hospital, had to have a cerclage put in, and then ended up having to have an emergency C-section at exactly 34 weeks. Was in the hospital for 5 days, and then after moved back to Ohio to be with my family and experienced some complications, went to the hospital and was in the hospital for hours, just in the waiting room. And not being taken seriously. It took several hours for them to just tell me that I had a pocket of blood that had been collecting in my pelvis and I could go home and it would dissipate over time. During that time, I was like asking, hey, can you tell me what's going on? I'm a new mom. I was breastfeeding at the time and pumping because my twins were on a special formula because they were low birth weight. And it seemed like nobody cared and it was dismissed. That was 15 years ago. And I'm still hearing the same stories today. And so I wanted to focus on maternal health and infant health when I came into the legislature. And so that's why, and I'm still a woman of reproductive age and would like to expand my family at some point in time, but I'm fearful of going into the healthcare setting, knowing that it does not treat me and others who look like me fairly. And I don't want that for anybody else. And I'm tired of hearing the stories. I want to be able to do something about it. And I think the answer lies within our community. So that's why it's very personal to me.
Wow, thank you for sharing that. Dani?
I'm a reporter, and I have been covering reproductive health for the past 8 years. I early on in taking on that beat, I got really interested in reproductive justice organizing. I had a lot of people of color, particularly Black women organizers, who really educated me and helped me and really taught me what reproductive justice is, and taught me that, you know, while many journalists would approach the beat that I was embarking upon as, you know, one in which we focus on abortion and contraception, that I really could broaden my view and look at, you know, our right to have children, to not have children, and to parent the children that we do have in safe and healthy communities. And that really caught my interest because just focusing on that right to not have a child felt too narrow to me. I started writing a story about the Black maternal health crisis when I was pregnant with my first child, who is now 3.5. And, you know, really I was inspired to write that story because the experiences that I was having as a pregnant person really drove home for me what I was, the research, right? So I was learning about, you know, the difficulty that Black people have in finding culturally competent care. I struggled to find a Black doula, a Black midwife, a Black OB. I really felt, I was really worried about how implicit bias was you know, of shaping my relationship with my care providers. I was reading about so many things that I experienced, you know, how Black women are so much more likely to have fibroids. I realized when I was pregnant that I had fibroids, and I was told at 14 weeks that I would need to have a C-section because of that. And I knew that the US was much more, that our C-section rate in the US was much higher than many other industrialized countries. So there was just a way in which my experience really echoed so much of what I was both learning from the organizers that I was reporting on, as well as the birth workers, the Black birth workers that I was speaking to. And so that kind of deepened my interest in continuing to report on this topic.
Wow, thank you to all of you for sharing your passion and what brought you to this work. So our first question, or second question rather, is for Erica. Can you share what initiatives and priorities is the Ohio Black Maternal Health Caucus focusing on to improve health outcomes for Black moms and babies?
So I'm really excited about the work that we are doing in the legislature. The Ohio Black Maternal Health Caucus was one of the first states. We are one of the first states to found a caucus dedicated to this right after the congressional members, Alma Adams and Representative Underwood, started that caucus. And so we have 11 founding members. Our co-chairs are Representative Boyd and House. And we got to work early on issues around this, trying to raise awareness. When it comes to infant mortality, the state has put millions of dollars behind that initiative, and we're really not seeing the reduction in disparities like we would like to. And there is no dedicated funding for maternal health. And so one of the pieces of legislation that got into the budget last year that started with our House Minority Leader, Amelia Sykes, was House Bill 434, which is the Pregnancy Associated Mortality Review Board. And some people know it as MMRC's, Maternal Mortality Review Committees. And that looks at the direct and indirect causes related to maternal deaths and severe maternal morbidity. That that got in the budget was just a skeleton. There had not been a report released from the Ohio Department of Health, from the PAMR board since 2014. They released one in November 2019, but we're already lagging behind on data. And so this requires an annual report on maternal mortality and morbidity, specifying the professions and the people who would sit on the board, and requiring that the board meet at least 4 times every year. And it's important for us to have a diverse group of individuals sitting on this board, because we know with MMRCs, usually they're voluntary and they are just experts, OBGYNs, usually primary care physicians, but we wanted to make sure that there were doulas on the board, or midwives, or people who have experienced severe maternal morbidity or those near misses, because we know with lived experiences and people telling their stories will give insight in what we need to do as legislators to address that issue. So we have House Bill 434 that had its first hearing in February. I gave sponsor testimony and was hoping that that was going to move fairly quickly, but because we're dealing with the pandemic right now, that has been put on hold. And I hope that when we get on the other side, that will move, because we need that data. It is very important, and it really drives the rest of the policies that we are trying to work on. So quickly, we had House Bill 435, which is Save Our Mothers Act. And that establishes continuing education requirements for birthing facility personnel, and an initiative to improve birth equity, reduce peripartum, racial and ethnic disparities, and address implicit bias in the healthcare system. And this is a piece of legislation that helps move the state towards becoming an AIM state. And AIM is the Alliance for Innovation in Maternal Health, and they have patient safety bundles that hospitals can adopt that help improve birth outcomes. Or we as a state, the Director of Health could opt in, and then hospitals can opt in. And we know in the states that have adopted patient safety bundles, they have reduced their maternal mortality rates, some by half, especially in California, if you look at them and how they've addressed infant mortality and maternal mortality. We also have House Bill 91, which is the Family and Medical Leave Program, which is authored by Representative Boggs and Boyd. And that just provides 12 weeks of family and medical leave insurance. And we know why that's important. You know, women tend to be the caregivers, especially in Ohio, where we have an aging population, or as my colleague Representative Boyd just adopted a baby in October and took time off to care and bond with her child. And families should not have to worry about keeping a roof over their head and the water running to be able to take care of a family member or their child. And just quickly, we have House Bill 11, which is sponsored by Representative House. It did pass the House of Representatives and it's in the Senate, and that is tobacco cessation and prenatal initiatives. It requires that Medicaid pay for 2 dental visits for pregnant women, which we don't talk about a lot, but we've been trying to raise that awareness that if women are dealing with, or birthing people are dealing with infections in their mouth and they're not getting those addressed, how that impacts the pregnancy. And then we have House Resolution 15 by Rep. Ingram, and that just urges Congress to continue the longstanding policy of providing states the flexibility to administer SNAP benefits in a way that they had been to meet the unique needs of families. We have heard the current occupant of the White House talk about eliminating and scaling back on SNAP benefits, and we know how that makes a difference for families. And then last but not least, Representative Paula Hicks-Hudson dropped today a co-sponsor request, which is for Medicaid reimbursement for doulas. So those are just some of the things that we are working on. We have other things in the pipeline, but those are things that are already out there that we've been talking about and trying to raise awareness about.
Thank you. And that last piece is a great segue to my next question for Bree. So how does your practice as a doula directly address specific stresses and concerns that Black women have?
Yes. So I am a doula with Black Birth Circle, which is here in Cincinnati, Ohio. And we do things with our clients throughout pregnancy, whether that's fertility, helping them get to the gestation point. And we address these concerns throughout. So whether that's checking in with them after prenatal visits, whether that's going to visits with them, we just show up in every way that our clients need. Sometimes it's more mental support, sometimes it's emotional, sometimes it's physical support. Like Erica was saying, we hear these stories all the time about our clients sitting in waiting rooms, not being listened to, not being validated, like their concerns. And so we take the time with our clients to just ensure that things that they're concerned about, things that, you know, that are not being heard, we just make sure that we're giving them the proper information and, you know, the most accurate information, and just helping them tap into their own power. But also, like, you know, using our own power to make sure that they're being heard and being listened to. And another thing that I want to talk about is that the risk for Black women, it jumps with every stage in labor. So delivery, postpartum, like it's getting more and more intense and aggressive. So yeah, I don't want to see more. I don't want to keep hearing these stories. I don't want to keep seeing people close to me, people in my communities dying and being harmed and not being listened to, not being validated.
Thank you. And so Bree, you kind of talked about, you know, not wanting to continue to see this in our community. And so Dani, you've been writing about race and reproductive health for a long time. How far have we come, and how far do we have to go?
So the story that I mentioned when I spoke before about, you know, I wrote this piece when I was in, I think I started it when I was in my second or third trimester with my daughter. This was in the summer of 2016. That story ran in February of 2017. And I remember soon after that, there was a flood of other stories that really did an incredible job talking about the Black maternal health crisis. So we saw NPR and ProPublica teamed up to do this series on Black maternal health. There was a cover story in the New York Times Magazine by Linda Villarosa, who's a longtime health reporter. She used to be the health editor at Essence in the 80s and 90s. There was just this kind of flood of really great coverage that did two things. One, it did not shy away from talking about the Black maternal health crisis. I think prior to this period, we heard a lot about the maternal health crisis without, you know, and the fact that the US, you know, is lagging behind these other, you know, countries without, you know, getting really granular with the data and with the fact that this is Black birthing people who are suffering. So that is a big shift that I've seen take place in the past, I would say for 3 or 4 years. So along with that has come, you know, this willingness to talk about the impact of, and here we get into language, depending on who you talk to, if you want to call it white supremacy, if you want to call it racism, if you want to call it implicit bias, but a real willingness to kind of talk about the role that a predominantly white medical system plays in these adverse outcomes for Black birthing people. That's been a major shift that I've seen in terms of media coverage in recent years. And then, you know, I mentioned some of these outlets that have been telling this story. You also have, you know, Self magazine, which is many people would see as like a lifestyle, women's lifestyle magazine that focuses on fitness. They were just nominated for a National Magazine Award for a series that they did specifically on the Black maternal health crisis. I was very honored to submit a story on birth plans for that series. So it's really, this isn't just like your prestige media, it's not just kind of your hard news media, it's been throughout all corners of journalism that we've seen a real willingness to talk about these issues. I think what's important about that is we've also seen a real desire to lift up Black people's voices. So that means the experiences of Black birthing people, as well as Black birth workers. And I think that that's critical, because when we talk about the fact that Black women are 3 to 4 times more likely than white women to die from pregnancy-related complications, we need to hear, and then on top of that, we know that there's often like a communication breakdown. There are these misconceptions that a lot of white medical providers hold about the Black body, you know, and I'm happy to give some data on, like, you know, these studies that show that you have residents who are well into their medical training who still hold these wild beliefs about like the Black body and Black people being less susceptible to pain than the white body. This is a UVA study that came out not long ago. So when you start to know these things, and it's like, well, what if you take that out of the equation? How do our outcomes shift if you have Black birthing people going through this process with Black OBs, Black midwives, Black doulas? And so that's been a real shift that I've loved to see recently as well, and that I really prioritize in my own reporting. Is like, let's call Dr. Joya Crayer Perry, let's call Dr. Monica McLemore. We have all these great sources nationwide who are Black women, who are working in the nursing profession, who are doctors, who are medical researchers, who can speak about these things. So I think that that's a major shift that's happened as well that I feel really excited about. In terms of how much further we need to go, I mean, there are just so many more stories to tell. You know, I'm thinking about that story that I did for Self Magazine about Black birthing people and how you put together a birth plan. I interviewed Dr. Karen Scott. She's an OBGYN, I believe at UCSF. She is part of a group out there that was doing focus groups in California. And she was saying that she was telling me about all these incredible findings, but one of the things that, this is just one little anecdote, that one of the concerns that kept surfacing was that a lot of Black men, so whether it be like fathers or uncles, brothers, were talking about how they feel that hospitals increase their surveillance, or that they feel like this increased fear from nursing staff when Black men are present, you know, with their family member who's giving birth. That's a story. Like, we need to talk about culturally what's happening in spaces where we're giving birth that make us feel less comfortable, that make our families feel like they're not welcome. I think that, like Representative Crawley was talking about, data collection, absolutely critical. And we're not in, like, we need that in order to again, get granular with like what's really happening. But I'm really interested in these kind of stories. We all hear about little things that the nurse said to us, or the lactation consultant said when we were trying to learn how to nurse, that made it obvious, like, you think I'm not smart enough to do this, right? I mean, there are all these things that we experience. And I'm, as a journalist, really interested in lifting up these stories, because it's all part and parcel of the ways that we feel disconnected from and not cared about by the people who we have to trust with our lives.
I was muted, sorry. So Christine, as a nurse practitioner, how have you seen conversations and concerns that Black women have about their safety and care play out in the medical setting in particular?
So I've seen both ends of the spectrum. Fortunately, I've witnessed a lot of safety concerns from patients that are handled appropriately with very good outcomes. These are women who may have experienced domestic violence, had housing issues, or inability to purchase certain necessities for the baby. With the close assistance of follow-up of caseworkers, community health workers, and the nurses, these women are able to escape their violent situation, obtain better housing, or obtain baby supplies. There are many resources available for Black women. We just have to keep spreading the word for these women to be able to get that. Unfortunately, there are also cases where mothers' concerns are often overlooked or ignored, sometimes swept under the rug. There's also instances where you know that some people feel like the safety concern of these women are expected, and therefore that behavior becomes accepted, and that's not acceptable. So we do have to step up, and a lot of times we have to speak out when we hear those things happening.
Thank you, Christine. So our next questions will be related to the COVID-19 pandemic. Starting with Representative Crawley, the Ohio Black Maternal Health Caucus released a statement on the allowance of doulas and perinatal support workers in the delivery room during COVID-19. Can you speak to the process and reasoning for releasing the statement?
Sure. So it was first brought to my attention through an organization called Restoring Our Own Through Transformation. They had reached out a couple weeks ago to say, you know, some of the hospitals were restricting people or visitors into the hospital as people were coming into labor and delivery. And I made some calls, but hadn't heard back because at that time, the governor had put in an order for hospitals to come up with a plan how they were going to deal with the surge. And then that next week, just a few days later, I got an email from Root with a email communication from Wexner Medical Center, Ohio State, where they changed their policy on April 1st. So this was April 2nd. They changed their policy on April 1st to explicitly exclude doulas. So as a visitor for maternal or labor and delivery, it said that you could have a support person there, but in parentheses, it said doulas are no longer permitted. And for me, I was just like, oh no, this is problematic, because for someone like me, when I even think about when I was giving birth 15 years ago, I was in Georgia by myself, in the hospital by myself. My family lives here. My children's father, active duty Navy, Florida. The only person that I may have had was my doula at the time, or even now. My family lives up in Northeast Ohio. I'm here by myself in Columbus. I don't have family. And so like, these are the knee-jerk reactions that cause us to have the outcomes that we have in maternal and infant health or mortality, or see the complications. We know toxic stress is an issue. And so I'm like, who are the people making these decisions? Usually they're not people who look like us. And so I'm like, this is where I need to step in and say, okay, I get that you might not understand that all family dynamics look different. And we need to take into consideration the experiences and the situations that some of our birthing people are in. And so I started making calls. I called Mike Morawski at Cradle Cincinnati. I was like, hey, are you hearing the same thing down there? He said, yes. I called Representative House in Cleveland and was like, do you mind putting some fillers out to see what you're hearing there? But I do want to do a statement from the caucus to say that we support doulas or perinatal support workers. As I was making the calls, I called Ohio State first, and when I was calling the health systems, and talked to the vice president, and she told me at the time, well, I understand, how about, doulas can come in, but as long like they don't say that they're doulas, and that they're just one of the support persons. And I'm like, that's problematic. Like, people should be able to say, or my rights as a patient, like, this is the person that I want, given that we're in a crisis. I get that. If we go through the proper protocol and there's PPE, then if I check out, or the doula checks out, then if this is who I want to support me, that person should be able to be there. And it shouldn't be under the guise of somebody else, or my sister, cousin, best friend, auntie, whoever. It should be in their professional capacity. And so that was what led up to that. And we do know that there were hospitals like Metro Health who allowed 2 people. So a family member or a spouse plus a doula or a perinatal support person. And that's what we want. We want people to be able to have their support, and not just because we're in a crisis. We've been in a crisis pre-COVID-19. So we just need to acknowledge that for what it is, and not be responsive in these knee-jerk reactions that will have negative impact later on, and we're still going to be dealing with the same situation, trying to deal with a crisis on our hands, because we have people making decisions that don't take our interest into consideration. And I get that. And I said to the Hospital Association, and I talked to First Year Cleveland and some of the other hospital groups, that I get that everybody has the same thought in mind. We want people to be healthy. We want people to be safe. We're not trying to spread the virus at all. But we have to take into consideration how these policies will impact people. Like, this is how we get into these situations, because we're not taking into consideration cultural competency. And because you have this thought process of what support looks like may not be the same for me. And so let's get into collaboration, into conversation about how do we make sure that everybody's safe and that my rights as a patient isn't trampled on. And so my colleagues in the Black Maternal Health Caucus all signed on. We believe that patient rights come first, and we can keep the health, safety, and welfare of individuals at the forefront without denying patient rights.
Thank you. And you actually touched on some of the things that Dani covered in some of her recent pieces. So Dani, you wrote a piece about the challenges of the current COVID-19 crisis for pregnant women on top of the existing ones that Black women already face. How can Black women prepare and advocate for themselves in this new world, this environment that we're in right
now? So I wrote a piece for Zora, which is a online publication that's connected to Medium, that's led by the former editor of Essence. One of the things that I learned in reporting that piece, I talked to Dr. Joya Creer-Perry. She leads the National Birth Equity Collaborative, and she's based in New Orleans. And she said that the first thing that she tells families and pregnant people is that people need an opportunity to grieve what they had hoped and planned that their delivery would be. So I think that that's just important to put out there. Like, people have dreams. A lot of these, these are children that have been, hoped for and planned for years. And so I really appreciated her just putting out there, like, let's give birthing people an opportunity just to acknowledge that they're not going to have the experience that they would have hoped for. But I think, in terms of families and Black women preparing and advocating for themselves in this new world, a lot of it is, connected to what we need to always do, which is making sure that we have community around us to support us. Jenny Joseph, who's a midwife who works out of Orlando, did this incredible video that she posted to Instagram and maybe her other social media, talking about ways that doulas can support families even though they might not be able to be present with them in the hospital, and how important technology will be for birthing families. How when we are in these situations, like what Representative Crawley talked about, where you can't have the first support that you want with you because maybe there's a limitation around how much support you can have, you can still keep in touch with additional people, maybe your doula, through phone calls, through FaceTime, that kind of thing. So having that community, making sure that you have the support that you need, even though it might have to show up in a different way. I think that's important. And then one of the people who I interviewed for the story she's actually a dear friend of mine, Chaiko Amawale. She's in Los Angeles. She actually gave birth yesterday, so her child is here safely and well. But one of the things that she told me when I interviewed her that I really appreciated, so Chaiko, her parents worked for UNICEF as she was growing up. So she grew up in Yemen and Sierra Leone and all over the world. And she was talking about how she, as a child, she had these experiences in war-torn countries. She was saying that this experience of being here at this time of COVID-19, not just the pandemic itself, but the failed government response to the pandemic, was triggering all these memories of growing up in war-torn countries where you have basically a failed state, where the government is not doing what it needs to be doing in order to protect people. And she talked about how important it was, how angry she was, and how scared, right? So often what we hear that Black birthing people are dealing with is fear and anxiety. And with the kind of longstanding Black maternal health crisis, it's because of a lot of things. I'm bringing this child into a world that's racist. How am I going to be able to protect this child? Maybe when I was pregnant, it was at the height of Black Lives Matter organizing, and there were a flood of Black people losing their lives to state violence. There are many reasons that we have to feel anxious about bringing new life into this world. At this particular moment of birthing a new child in the midst of a global pandemic, it's kicking up that fear and anxiety, and in some cases anger, right? And that's what my friend who I interviewed for this story was talking about. I'm angry. We should have a better response, a better federal response to what's going on. One of the things that she talked about was how not helpful it was when people told her not to be angry and to be positive for the health of the fetus. and that she really appreciated that her midwife was like, be mad. What can we do together to like work this anger through your body so that you're not holding it? And I think that that's something that another form of support that we can seek out is like, who are going to be the people that can really hold the full range of emotions that I'm experiencing and not tell me to tamp it down, you know, for their ideas of what a pregnant person should be feeling and experiencing in any given moment. So yeah, that's what I would say in terms of the ways that we can seek out support in this moment.
Thank you. I really love what you're saying about recognizing and leaving space for that range of emotions that we're going to be feeling during this time. And so, Bree, how has your doula support service evolved and shifted due to the pandemic?
Yeah, it has changed a lot. It has evolved a lot. I think for many of us, offering more virtual support, whether like Dani was just touching on, just offering more FaceTime, more Skype. We're also, I know a few doulas in my circle are starting to offer more services towards the actual support person that the client wants to be in the room with them. So in the event that they would rather have like their mother or their father or the child's father in the room with them, like just doing more hands-on with them so that, you know, and then we can support everybody virtually. So we've had to really get creative as far as like how we can best serve people and just create the best possible outcome. And like Dani was also saying, like honoring them in their fullness, that's a piece of that. Not trying to make them feel like you shouldn't feel this way. Let's be positive so we can, you know, like have them, like I can be mad, I can be upset, but also using that to bring baby here safely. So like a few of my clients that I've had, I've just been like celebrating them hardcore because having a baby right now, it is scary. It's a very different time right now. So I've just been trying, like a few of my clients that have older siblings, just trying to get them to be more apart, trying to like we've baked cakes and, you know, just done different things to just celebrate the birthing person, because right now it's very different. And I've also been trying to get people to start thinking of a plan. So right now we don't know what's coming. This is all new for all of us. So just trying to get more familiar with the research that's coming out, trying to get more familiar with how we feel about a vaccination if it's offered to us. There's vaccinations now that many of us don't know about, or, you know, don't know how we feel. We'll just say yes. So just trying to make sure that we have the adequate information so that when that time comes around, some people, are we going to be able to go back to work? And, you know, what do we do about housing? So just trying to develop a solid plan so that when things happen, we know we at least have a foundation, right? And then if we need to make adjustments or we need to make changes from there, we build from there, but at least have something to stand on.
Thank you. So Christine, what advice can you share with Black women who want to keep themselves and their babies safe and maybe overwhelmed by the constantly changing information and conditions?
I first want to say to everybody, breathe. Just because we got this, we will make it through it. We're all overwhelmed, from patients, staff, providers. Everybody's overwhelmed because just like Bree said, this is new to everybody. Like, this is nothing that any of us have ever experienced. As far as giving advice to our patients and their babies, I just want to continue to encourage them. You've been hearing it all over. Wash your hands frequently. Make sure anyone touching the baby should wash their hands prior to contact. That's grandma, mom, cousin, siblings, even mom. If children don't have to go to the stores or public places, keep them home just to avoid large crowds. I've also been encouraging my patients to make sure they're covering their coughs and sneezes with a tissue or their elbow if they have to. with those basics that they've kind of been drilling with us on the media, TV, CDC, with the exception of like avoiding large crowds, those are basic housekeeping habits that will help decrease the spread of any kind of infection or germ aside from coronavirus. I also want to emphasize to all my patients and women out there, don't be afraid to ask questions to your provider, to the doctor, to anybody, especially when it comes to your body and your health. Like, you know you best. So if you have a question, ask it. If you have a concern or if something doesn't sit right, ask. And if you don't get that answer, keep asking and keep going to different people until you get your problem addressed.
Thank you for those tips and just reminding us all to advocate for ourselves, as all of our panelists have said. So my final question to the group is, this year's theme for Black Maternal Health Week is Centering Black Mamas, the Right to Live and Thrive. What does this mean to each of you in word and practice? So I'm going to go to Representative Crawley first.
I think it means the same thing that I said in introduction, listening to Black women and sharing our experiences or the experiences of just birthing people and what we're going through. I think the answer to this crisis lives within our community. And so just continuing, I know with the Ohio Black Maternal Health Caucus, what we will continue to do is have meetings across the state where we bring in stakeholders where they can listen to each other to see, what different organizations are doing to support this work, but also listening or having interested party meetings where we have birthing people who have had all kind of experiences, whether they've lost a child or had complications. I think it's necessary for stakeholders to hear, what is going on in people's lives, so they know, what policies need to be implemented, the funding behind the policies, because it doesn't make a difference if we have policies in place or we implement them, but we're not putting funding behind it to make sure that our communities are supported and lifted up. So I think that's how we center Black mamas, just continuing to listen to them.
Thank you. Christine?
So I interpret this year's theme as empowering Black women to speak up about their health to ensure better health outcomes. As I said previously, don't be afraid to ask questions. My goal is to educate my patients and empower them to ask questions about their health, and recognize if something seems off so they can ask the appropriate questions and become advocates for themselves as well.
Thank you. Bree?
For me, this means centering and tapping in and being aware of the power that we already possess as Black people, Black women, Black birthing people. It just means tuning into that power and that we already possess, but sometimes we need that support. We've seen what support can do for us, for other people. And for me, just being that support person, whatever I don't have access to, I can find somebody who does. I don't, there's a lot that I may not have or I may not do, but I know somebody who does. So it's just a matter of pointing you in that right direction. And I also wanted to plug Black Birth Circle one more time, just because we are in Cincinnati, Ohio. So we are on social media, on Facebook, on all social media platforms, but please inbox us on Facebook. And our point of contact person is Jamaica Gilliam. She is also a certified lactation consultant as well.
Great. And Dani, what does this theme mean for you?
I wish I had something original to add. I think everyone's really said what I'm feeling, which is that I'm interested in people not talking around us in the process of talking about the Black maternal health crisis, but speaking to us directly. We hold a lot of information, and I think that if there are any journalists, storytellers, media makers watching, I think that's a special invitation for you specifically. I think there's a way in which this issue can be covered, and there's a scramble to talk to people who are seen as leaders and experts on this topic, who are not us. And while there are plenty of incredible like people in medicine and healthcare, and people who are, you know, birth workers who are not necessarily Black, and if they can speak to, if they have solutions or there's been something in their clinical practice or in their research that's relevant, of course, their voices are welcome, but not at the expense of centering our stories as clinicians, as experts of our own experience. And so, yeah, I think, you know, nothing for us without us, or whatever that phrase is. So I'm just hoping that Black birthing people's voices continue to be lifted up.
Well, thank you to all of you for your answers and your passion around this discussion. We are going to close our panel now, looking at the time and being cognizant of that. We definitely want to encourage everyone to continue to talk in the comments and chat and engage and keep the conversation going. Thank you again to our panelists for the work that you do in this space, for your dedication, and for sharing that passion with us today. So the next live will be Friday, April 17th, 11 a.m. on Facebook Live. Queens Village is hosting a Friday Fun Day, which they do every week. And so this week is going to be Yoga for Mamas and Mamas to Be with Kimberly McGinnis. So we hope that you will all join in for that. And thank you again.
Thank you.
Bye.
Thank you, everyone.